Are you experiencing any kind of autonomic nervous system dysregulation? Perhaps you're experiencing heart rate fluctuations, blood pressure issues, things like tachycardia, and maybe you're experiencing even anxiety and or depression. Well, this can be a really great technique that can address the vagus nerve and also the lymphatic system, and it can have a profound impact very immediately on your nervous system response as well as the lymph system. Hi, my name is Dr. Arianne. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and owner of the Movement Paradigm Integrative Health Center. So please feel free to check out all of our other vagus nerve exercises. This today is one of my favorites. So we're going to talk about the myofascial technique that you can use to address the vagus nerve specifically and bonus influence the lymph system. So you can check out my other video on the lymph system to get a little bit more detail. But when we're thinking about where the vagus nerve exits, so think it's exiting from the jugular foramen in the brainstem. And as it exits, we're going to have branches into the ear. We're going to have branches into the back of the throat. And then we have, as it comes down through the neck area, I think it's coming right behind the ear here. And then it's coming down in this kind of like subclavian area. So under the thoracic inlet. So you can also check out my other video on that as well. Today, we're going to focus on this area. So this is where we also have a lot of lymph. And so when our lymph becomes stagnant, when it becomes congested, whether that's something obvious, like we're sick, or we've had a virus, for example, when they've done ultrasounds on people with COVID, they found that the vagus nerve here has been thickened or even a little bit fibrotic, so indicative of some previous inflammation. So when we're influencing this area, it can have a very, very profound and very quick effect. It can cause an increase in blood flow and circulation. It can have a little bit of lymph drainage and therefore also stimulate the vagus nerve. So without further ado, I'm going to show you how to do this. So I'm going to show you on one side, but we can also do this with two hands. Okay, so we're going to take a flat hand like this. You're going to come right underneath of the neck here. So I'm kind of like right underneath of the jawline. And what I want you to think of is tractioning the tissue. So I have a flat hand. I'm going to traction the tissue up towards the back of my ear. So it's as if I'm going to do it from the front. It's as if I'm doing a little bit of a facelift. So I'm tractioning the tissue. So it's the myofascial tissue. And really all I'm going to do is just hang out here. So if I want to just rest my elbow, I'm just going to kind of hang out. And I'm just waiting until... So I already had a yawn. So a sigh, a swallow, a yawn. It does not have to be one of those specific reactions. It could also be that you just feel relaxed. It could feel a sense of warmth or even coolness, actually. You could feel it into the face. You could feel it down into the neck. And you could also do this with both hands. So you could take both hands here, right? So I'm on either side, right under this jawline, and I'm tractioning the tissue up. So it's again, as if I'm giving myself a little facelift here, and I'm just hanging out. So there I had to swallow pretty quickly. You may not have a reaction very quickly at all. It might feel like you might not have one for a while, and that's okay. I've been doing a lot of these and I do them regularly, so my body knows to respond quickly to the stimuli. So in your case, just be patient. Really, there's nothing bad that can happen. So if you're just hanging out and you're being gentle, which is really important because there's a lot of really important structures here, just gentle. There's no digging, you're not going deep. And I'm just gonna kind of go up close one more time so you can see. So right here, okay, and then we're going to traction the tissue up. That's it. Okay, so I'm here, tractioning the tissue up. Okay, and then from there, again, you might hold for anywhere from 30 seconds, maybe up to 2 minutes. You could do it with both hands. And you likely will have a pretty quick response. And this can be a really great technique to do anytime throughout the day. So sometimes if I'm feeling like I just need to do it during a session, or when I'm just feeling like, oh, I have a lot going on, I just want to do a quick technique to regulate, that could be something very simple that no one even knows you're doing. So hopefully this is helpful. It's one of my favorites. I give it to my patients so frequently. So I hope you enjoy as well. If you do and you have a positive response for it, or even if not, feel free to drop in the comments below. I'd love to hear. Of course, give it a like, give it a share, and subscribe to our YouTube channel, The Movement Paradigm, for tips on whole body wellness to really help you thrive. Also, make sure to check out our app, the Movement Paradigm app on Apple or Google. And you could also reach out to us for a discovery session. So if you're looking for help on your own individual journey, we would love the opportunity. All right, thank you. See you next week.